When we think about modern public health today, we usually picture sleek laboratories, rapid digital disease surveillance, and massive global vaccination campaigns. But it's kind of wild to realize that the absolute foundation of this entire system wasn't born in a sterile lab. It was actually forged in the fire of terrifying massive epidemics in colonial India. So let's dive into this explainer because we're going to see exactly how 19th century crises inadvertently built the very healthcare systems we completely rely on today.
I want you to just take a second and imagine stepping back into the early 19th century. You're facing down these devastating invisible killers. You've got no antibiotics, you have zero microscopes to even see the pathogens. Actually, you don't even know what germs are yet. This sets the stage for our historical journey. I mean, really, how do you stop a spreading disease when you don't even know how it spreads?
And to make matters worse, the sheer terrifying scale of the challenge was just immense. The imperial government was suddenly responsible for this geographically massive territory. We're talking about environments that range from the highest mountains in the world all the way down to dense tropical forests and barren deserts. And this incredibly diverse region harbored unique endemic tropical diseases that the British East India Company literally had absolutely no experience with.
Okay, so the crucial point here is this staggering number, 69. By 1863, reports were showing that 69 out of every 1,000 British troops in India were dying from disease. That is a massive mortality rate. The colonial administration quickly woke up to the fact that if they didn't get these endemic diseases under control, they wouldn't even have an army left to maintain their empire.
Which brings us to a rather cynical but highly important question. Why do you think governments became interested in public health only after major epidemics? Well, it wasn't exactly pure altruism. The survival of the military and the sheer economic interests of the East India Company necessitated immediate, drastic action. This massive crisis forced a complete administrative shift, pivoting their focus sharply toward military hygiene and basic sanitation. Basically, early public health was entirely about keeping soldiers alive.
Section 1. Cholera, the Sanitation Awakening, a shift in scientific thought. So, cholera initially baffled the empire between 1817 and 1821. It was devastating, it was lethal, and it forced medical officers to ask how on earth it was traveling across the country. Early on, the government's chief advisors stuck to these meteorological theories. They basically believed cholera was spread by atmospheric air conditions like a bad miasma. But thanks to some pioneering epidemiologists working in India, like Surgeon W.R. Cornish, who meticulously tracked cholera outbreaks among troops, the consensus dramatically shifted. Through rigorous surveillance, they realized that the disease was actually contagious and directly linked to the environment. And this realization brings us to a vital question about environmental hygiene. What happens when hundreds of thousands of people gather without any clean drinking water? The data showed that cholera was just exploding at massively crowded religious festivals and fairs. Contaminated water imported by pilgrims and traveling troops became the primary vector. This was a massive light bulb moment for them. You couldn't just treat the sick, you had to proactively manage mass gatherings and secure clean water sources.
Section 2. The devastation of plague. The 1896 Bombay epidemic.
Just as they were getting a handle on cholera, a completely new nightmare began. In 1896, bubonic plague hit the port of Bombay. Being on a major international trading route, the pressure to contain it was immense, but it spread anyway, eventually claiming over 2 million lives by 1903. To fight it, the government passed the Epidemic Diseases Act of 1897, which was a deeply iron-fisted approach to disease control. They instituted forceful segregation, stopped and inspected trains and ships, and literally demolished infected homes. Naturally, this led to massive public riots. But from a purely administrative standpoint, this was essentially the brutal, forceful birth of modern epidemic surveillance, quarantine, and transit control.
Now, despite the horrific social upheaval and military enforcement, these desperate measures led to massive scientific leaps. By 1904, the Plague Commission concluded the disease was highly contagious via human transit. But more importantly, this crisis forced the large-scale deployment of Haffkine's anti-plague vaccine. This is huge because it was one of the very first times we saw mass inoculation used as a primary weapon to turn the tide of a sweeping epidemic.
Section 3. Malaria and scientific breakthroughs. Connecting the mosquito.
Okay, here's a really fascinating paradox for you.
The government built vast new railways and irrigation networks, right? But without proper drainage, they unwittingly created massive freshwater pools, turning these brand new infrastructure projects into giant mosquito breeding grounds. Consequently, fever mortality absolutely skyrocketed. The solution to this came from meticulous scientific research. After observing this massive mortality, Surgeon Major Sir Ronald Ross began microscopic studies, and he finally demonstrated the life cycle of the malarial parasite inside the Anopheles mosquito in August 1897, which actually earned him a Nobel Prize. This sparked a massive policy shift from just handing out quinine pills to actively modifying the environment to eradicate mosquito breeding pools.
Section 4. Building a healthcare system. From reactive to proactive.
All of these terrifying epidemics acted as an incredible catalyst. The colonial administration realized they could no longer just react to outbreaks with military force. They were forced to rapidly professionalize and build a structured, permanent healthcare system piece by piece. In 1873, realizing they couldn't track diseases without solid data, they passed the Birth and Death Registration Act. By 1880, they introduced compulsory vaccination, and in 1884, they built the first central medical laboratory in Kasoli. This was a total game changer, moving them from guesswork to actual data-driven epidemiology.
But of course, none of this shiny new infrastructure works without actual trained professionals. Institutions like the Calcutta Medical College and the King Edward Medical College in Lahore became the very first centers of Western medicine in Asia. And crucially, while the top medical officers were initially European, these colleges began training native Indian professionals. This is what allowed the medical workforce to rapidly expand across the continent, reaching all the way into rural dispensaries and district hospitals.
And that professionalization built into an undeniable success story of scale. By 1902, the number of public hospitals practically doubled to 2,500. Patient turnover tripled to nearly 22 million people. Millions of successful childhood vaccinations were being administered, and a whole network of central and provincial labs was launched. It's truly incredible to see how a reactive, self-serving military medical service fundamentally transformed into a massive public network serving tens of millions of everyday people.
Section 5. The legacy we inherited. Connecting the past to the present.
Because you see, the frameworks built during the British Raj didn't just disappear when the empire fell, they actually became the bedrock of global health today. Think about it. The 1873 Birth and Death Registration Act is exactly what we now call vital statistics and epidemiology. The Aggressive Plague Commission of 1904 established the protocols for modern outbreak investigation and surveillance. And the Kasali Laboratory, that's the direct ancestor of our modern reference public health labs. Every single modern tool we use to fight diseases today was literally forged in the fire of 19th century colonial India's epidemics.
So, I'll leave you with this provocative thought as we wrap up this explainer. When we look at the sophisticated, data-driven public health systems of today, how much of that infrastructure is simply standing on the shoulders of the survival lessons learned the hard way in 19th century India? The next time you hear about disease surveillance, mandatory vaccinations, or even just municipal sanitation, remember the centuries of struggle, the staggering loss of life, and the absolutely incredible scientific discoveries that made it all possible.